My doctor recommends semen analysis. What does this mean? Semen analysis is one of the first tests recommended in the evaluation of male factor infertility. In couples that are infertile, male factor infertility is at least partially responsible in up to 50% of the cases. For semen analysis, a semen sample is taken and examined under a microscope in the lab to mainly look for three things: the sperm count or the number of sperm, the sperm motility or how active the sperm are, and the sperm shape or morphology. Semen is the grayish-white fluid that's released from your penis, usually after an orgasm, and mainly consists of sperm, which is the male reproductive cell, fluids that lubricate the urethra, and proteins, vitamins, and minerals which help fuel the sperm. A semen sample can either be collected in the comfort of your home or at a private room at the lab or the fertility clinic. It's collected in a sterile wide-mouth container that's provided by the lab, and you should refrain from any sexual activity for about 2 to 3 days prior to collecting your sample. If you collect your semen sample at home, then it should be brought to the lab within 1 hour. So what are some things that are examined on semen analysis? The first is the pH or the acidity of the semen. If the semen is too acidic, it can affect the health of the sperm. The second is semen volume, that is the amount of semen in your sample. The third is sperm concentration. This is the number of sperm per milliliter of semen. The fourth is sperm morphology. In this, your sample is examined under the microscope and the percentage of abnormally shaped sperm is determined. The fifth is sperm motility, or the ability of your sperm to swim. In this, the percentage of sperm with normal forward movement is determined, and also your sperm's ability to move through the cervical mucus and fallopian tubes is determined. Number 6 is the time to liquefaction. This is the time that it takes for your semen to go from a gel-like consistency to more liquid. It usually takes about 20 minutes or so. If it takes too long for your semen to liquefy, it can indicate an inflammation of the prostate or the seminal vesicles. And lastly, white blood cells. The presence of white blood cells in your semen can indicate an infection or inflammation, which can weaken the sperm and affect its movement. After reviewing the results of your semen analysis and examining you, your doctor can recommend the next steps in your fertility treatment.